ki mai anō ki a warrant of fitness. Coming up, we find out the results of Charmaine's CT scan.
Okay, you're going to have your arms above your head when this goes in. Now, there is no metal in here. It's all plastic, so you can actually bend your arm a little bit. Just bring your arm up.
Oh, that's sore.
Try it, and I'll put another pillow underneath. Okay, we have another pillow? How's that? Try that. How's that? Why don't you bring it across here? All right? Okay? So we're going to go in, and we'll line up. Okay? And all you've got to remember to do is small breath in and hold it in.
It's like going to bed with no shoes. Oh, with shoes on.
Exactly.
Just going to check again it's in the right place. And let me know if your arm gets sore, okay? Straight away.
Breathe in and hold your breath. Breathe normally.
You're all finished.
How was that hot flash? Very hot.
Very, very different.
Yeah, weird.
Not unpleasant.
Have you got that funny taste in your mouth?
I did when it first went through and started getting hot.
Yeah.
Bring your arms
Yeah.
Yeah.
Oh.
We keep this line in for 10 minutes to make sure that you're not going to have a small reaction to the
Okay.
contrast.
Yeah.
You're not likely to, but we're just being careful.
Oh,
Okay?
yeah, fair enough. Oh, well.
That wasn't too bad.
Yeah, that's right.
Fear of the unknown, but it's not too bad.
That's it.
Kua mutu te CT scan, engari he take anō kei ngā whakaro o Charmaine.
You're dizzy. Once you're ready to go, we'll swipe you through. Do the security.
How your morning been?
Not very good. They're trying to force me to have chemo, and I've still got open wounds, and my hand's worse.
Talked about that, you didn't want that if you were going to have still got the wounds and infected.
They're pushing me down it, yeah. Sort of got me going again. Yeah. And I said to her, they make appointments for chemo, I'm not coming. As long as my wounds and these ones are still open, that I am not coming for chemo.
So you've been through a lot today. How was your scan?
Scary, because I don't know, it's my first time being through anything like this. And yeah, and I'm glad I got my sister-in-law.
Chemotherapy and radiotherapy involve many visits to the hospital. With chemotherapy, you're injected with powerful anti-cancer drugs which are designed to kill the cancer cells. With radiotherapy, you're subjected to doses of radiation, which again are designed to kill the cancer cells, and both of these treatments are designed to treat and cure cancer where it's not possible to remove it by surgery.
I've got to let it try and still understand and accept it myself. Whether I'm being a cow and saying, no, I'm not having chemo, but it kills my immune system. If I've got haki-hakis like this now, and those open wounds there, on both sides, it's my body that's going to be affected. I've been through it once, and I don't feel like going through it again, regardless of what the specialists say. I prefer my body to be all healed before I go through chemo.
You always hear a lot of the time there's a waiting list for chemotherapy. Sometimes you almost wish, why couldn't there be a little waiting list today? Yeah.
Yeah. And you're right. I wish there was a 6-week waiting list for me. Yeah, but it can't be that long when they're pushing me like that. I've got a 14-year-old daughter inside, also for her too. Because, yeah, I've got to be positive. I've got things I have to do. And one is I want to see her 21st. Yeah, that's one of my main ones. Yep. and I'm going to do it too.
Kei a Curtis, ngā pepa e pāna ki te CT o Charmaine, ko te tumanako ka tautoko e nei I ona hiahia.
Right, looking at your scan results here, I'll go through them. Your chest, your lungs are clear, okay, as far as we can tell on the scan.
Yep.
It's never 100% the scans, but as far as what we can say.
Yep.
Okay. They think, looking at the scan, that there's a little bit of what's after your operation, just like scar tissue and that they can see under both sides here. Okay.
Yep.
Again, not saying that that's cancer, but that's why you go through the chemotherapy and the radiotherapy just coming up, okay, just in case these are traces here, okay, to try and get rid of those.
Okay, yep, sweet as.
Sweet as?
Yep.
With your liver, there is one little spot on there which they're talking about, and that's not saying that that's cancer.
Yep.
A lot of people have spots on their liver, but that's another reason why at this time they're sort of saying, when you're ready, you know, it's time for your chemotherapy.
Is that why they got benign?
That's why they got benign. That's what benign means. Benign means kind of, well, pai.
Well, what do they put that instead of
those right in Māori? Well, maybe that's something that we should be talking about. And what would you say to other women who are watching who may themselves be going through this experience?
I was saying to my 14-year-old, all my young nieces, all their friends, even my sister and them, you check yourself all the time. I've actually taken the pamphlets from North Shore. They've got little pamphlets on how you check yourself, because you have a shower every day, you lie on the bed every day. So that's when you check.
And if you find something?
You just go to your doctor, you know, and then everything will work from there. Yeah, but don't be frightened. Don't be frightened.
Ka tae te whakaora, te nuina o nā mate pukupuku. Engari, ko etai o tātou ki te tino mataku nei mō tērā kupu, mate pukupuku, ka tae ka whakaaro, mate tūturu, mate rawātu. Engari mō tēnā. Ka tae te whakaora. Mena ka mahi tahi mātou, nā rata, nā tākuta, me nā tūroro. Yeah. He nui nā mahi, engari. Ka tika tērā kōrero, ko wetahi o nā mate pukupuku, ka reroa, ka mate rawātu tēnei tangata. Ka aroha ahau mō tērā, engari he maha no atu nā mate pukupuku ka tae te whakaora.
Ko megi ahau, e ono te kauma toru oku tau I nāne. Taku mahi e haere ki ngā kāinga, ki te titiro, ki ngā whaia, ngā māma, me ngā kuia, ki te kōrero ki a rātou ki tēnei mate pukupuku I roto o rātou nei Ētahi o rātou I kore whakarongo, ētahi o rātou e mohe ana, e whakamāna, ētahi o rātou e māngere ana, ki te tū, ki te haere. Engari te tikanga pena mohe ana rātou ki te tino pūtake o tēnei mate, te mate e harake mā tau iwi e kōrero mā tātou no tō tātou ne iwi e tiaki. Pēne I a hau ne haere ana ki ngā kāinga, kia maha ke ngā wāhine Māori, ki te awhi I o tātou nei whānau. Te kōrero tēnei mate, no te mea te nuinga o tēnei mate ki runga I a tātou te iwi Māori. Ahakoa, mate āta kōrero kia rātou, ka tai koe ki tō rātou ne mohi o tanga. E tahi wā, tahi haora, rua haora koe no hoi, kōrero e kia rātou, mohi no koe te ahu o tō tātou iwi Māori. Ai, a pōpō pēr, ko hoki atu nau. No te mea ko rātou te ukai pō o te whānau. Ke te ora rātou, ko ora te whānau. Ke te kaore rātou e ora ana, ka mate te whānau.
Coming up, Whaia Maggie walks her talk.